As well, multiple genes are believed to contribute to the disorder's manifestation, but everything is not concrete right now. Muller also states that there are neuroimaging studies that have impacted dysfunctions in the CSTC circuits, which are a crucial aspect for regulating momentum and behavior within the circuit. There are multiple abnormalities that could lead to the rehabilitation that is seen in Tourette behaviors. In addition, dopamine plays a big role in these behaviors, and an increased dopaminergic activity in the basal ganglia is also sought to be an important aspect of the severity of a tic. Lastly, environmental factors play a significant role in the expression and severity of Tourette syndrome. Prenatal and perinatal complications such as smoking, stress with pregnancy, and birth weight increase the risk of developing Tourette syndrome, and these environmental factors play a huge role in the etiology of this disorder. In addition, exposure to certain infections can also play a big role in the development of Tourette syndrome. But overall, there is a great interplay between genetic, neurobiological, and environmental factors, and understanding these elements and taking action in that could ultimately prevent this from occurring. Transitioning to treatments. Tics used to be connected to nature from both a sexual aspect and from a narcissistic perspective. For Nancy believed that tics were equivalent to an onanism, and this was related to the elevated sexual desires and the battle between the id and ego. Therefore, psychotherapy became the primary role for treatment in the early stages of this disorder. But as times went on, pharmacopsychotherapy rose in the mid-20th century, and then researchers discovered that the dopamine receptor blocker, haloperidol, may reduce the tic-related symptoms that patients were showing. This was said by McKnight. While some drugs were found to be helpful, they were not made for that reason. And so by this time, prescriptions were an option, but behavioral treatments started to teach an individual how to alter their environment to reduce the severity of the tic. And this was said by the American Academy of Neurology that they rate the comprehensive behavioral interventions for tics as extremely effective for tic reduction in both children and adults. In a behavioral psychotherapy study, a randomized controlled trial involved 32 individuals with Tourette syndrome. The efficacy of habit reversal is tested by setting up 14 sessions to either support or do habit reversal training. The trial contained 29 patients who completed at least 8 of the sessions, 13 of them being supportive psychotherapy patients, and 16 in the latter group. Now the results, they showed a significant improvement in the habit reverse group, but not just for the trial time, but also 10 months later, and this demonstrates the usefulness of this behavioral therapy treatment. In addition, the growing of drug-resistant patients has put a stop and a halt to a specific type of treatments, but has also led as a segue to deep brain stimulation. As said in deep brain stimulation, this form of treatment utilizes an implantable electrode to alter the activity of brain circuitry, and this must have the implantable electrodes programmed to a pulse generator. Based on the symptoms that the patient has, will determine where it is placed in the brain. Once the wires are placed, then there's another surgery that connects the wires to the pulse generator, and the goal of this is to block the abnormal signals that are causing the tics. While this is a new opportunity, there could be severe symptoms that have not been demonstrated yet, but overall there are multiple treatment options that are available to those
Okay,
that
question
desire
number
to
6
have
is,
it.
do you ever experience intrusive thoughts or obsessive behaviors with your tics? This is actually a pretty funny question to me because I have a great example of this, and it happens every time, no matter what I do to avoid it. But I really like to bake and I really like to cook, but that and Tourette's does not mix very well. Per se, a knife, an egg. If there's an egg, I'm going to throw the egg. It is going to be broken on the ceiling, on a person. I just don't know why. I know I have to be careful with it, I think. So I obsess and think about, I can't break this. And then my impulses obviously want to break it. That's a lot of similarities, like with Tourette's. If I know I'm not supposed to do something, like say I have a plate that's very fragile, like a dinner plate, and I'm holding it, and I know I'm not supposed to drop it, I want to drop it. So I'm thinking about it, so it's for sure gonna happen. I wouldn't call that that's more of like, I'm obsessing over not breaking it, and it ends up being broken. Yes, I have intrusive thoughts. One of my tics on a really bad day is I will punch people. It's not funny, but it's pretty humorous in my household because my family will just be like ready to go. Like, they will fight back. It's pretty funny at this point.
The prognosis of Tourette syndrome goes hand in hand with what Molly was just saying, specifically due to her Tourette syndrome and due to her OCD. Tourette syndrome is a neurodevelopmental disorder and typically emerges in childhood, but the prognosis of Tourette syndrome varies among individuals and is influenced in a variety of different ways. There is the impact of comorbid conditions. The presence of comorbid neuropsychiatric conditions influence the longevity of the outcomes with Tourette syndrome. Common comorbidities include attention deficit or hyperactivity disorder, simply ADHD, obsessive compulsive disorder, OCD, depression, and anxiety disorders. While the tics may diminish with it, these comorbid conditions are often persistent and affect every aspect of a person's life. Similarly, there are natural causes of Tourette syndrome that run its natural course. Research often points to a developmental trajectory of Tourette syndrome. It is often intensified and at its most heightened state in childhood, which peaks between 10 to 12 years of age, and then usually there will be a reduction in the severity into late adolescence and childhood, but this is not the case of most. However, approximately 10 to 20% of cases say that the tics are persistent and could become worse as they grow into adulthood. While the Bible does not specifically mention this syndrome simply because it was not a label back then, there are individuals in Scripture who demonstrated these behaviors that could be interpreted as similar to some of the symptoms as we see in Tourette syndrome, such as vocalizations, conditions that affect their mental and physical well-being, and involuntary movements. But that does not mean that we are able to classify and give this label to those figures because this disorder was not created in their time frame. First, we could talk about King Saul, as we see in 1 Samuel 16, verse 14. Now the Spirit of the Lord has departed from Saul, and an evil spirit from the Lord tormented him. And so King Saul was the first king of Israel and experienced a lot of distress that was very sudden and uncontrollable, that resulted in uncontrollable behaviors. And this could be seen as a psychological or neurological condition, such as the torment that was received from the Spirit of God that caused him to act in a certain way. But we see that the Bible describes these episodes more as divine judgment and less focus on a medical condition. So the nature of Saul's spirit could be actual psychological distress and suffering, or it could represent a disorder such as Tourette syndrome that we have labeled today. Similarly, we see in the New Testament a man with a demon. This is found in Mark 9:17 through 29. And a man's son is said to have a demon that's possessed by a spirit and causing him to have convulsions and screams and vocalizations that are uncontrollable. Within this demon possession, there are symptoms such as falling to the ground, grinding his teeth, foaming at the mouth, and could be associated with motor behaviors. But again, this was rather than a neurological condition, a spiritual affliction. Mark 9:17 through 18 says, a man in the crowd answered, Teacher, I brought you my son who is possessed by a spirit that has robbed him of speech. Whenever it seizes him, it throws him on to the ground. He foams at the mouth, gnashing his teeth, and becomes rigid. So we see in these two examples that there are individuals who are described as the symptoms for Tourette syndrome. But that does not mean that we're able to confidently diagnose them. In this context, there should be a lot of focus on the compassion and healing that God gives through these scenarios, despite the neurological or psychological conditions, and look past what our eyes can see and more on what the Lord sees through them. Now, these are the sources for my documentary. I also just want to give thanks to the people that were involved in this, including myself and Molly, for being such a helpful part of this process. That is within the course of abnormal psychology, Psych 350, here at Anderson University on March 24th.